Okay, you're listed there.
Mm-hmm.
That's Anne Marie, I think.
Yes, it is.
I see
You-
I see Susan's name and I can hear you, but
And Dr. Marvel is here with me too.
okay.
But you cannot see me?
I cannot see you.
My wife's away, so I have to use my next best guru.
It says, Anne Marie, it says I
Yes.
cannot start the video because the host has disabled.
Oh, that again. I'll fix that.
Okay.
Yeah, we fixed that going forward in the setup.
Now it says stop video, but that's okay.
Yeah, there's your video. Yeah, here I am.
Yeah. So now we're both in there?
Can you hear us?
Yes, I can hear you.
Yeah,
Sorry, I was muted.
Okay. Okay.
Are we the only ones here?
So far, I mean, we have people in the attendees, but not the actual members, but we've got 5 minutes, so.
So when are you leaving for Florida?
Wednesday the 14th.
Well, have a safe trip.
I will. I'm just very careful.
You're going by yourself?
Mm-hmm.
Are you flying?
No, I
No.
drive.
Okay.
No, I don't want to go in any airplane, any airport with all this mess. No, I am going to drive by myself. 12, and I said to Fifi, I said, you know, it's bad when your life is so boring. You're looking forward to a 1,200-mile drive.
Where's she live? In North
She lives in Fort Pierce.
Fort Pierce.
It's about 2 hours north of Miami.
Yeah. I know when we came from Key West, God, it seemed
That's a
like
long
forever
ride.
to get through Florida.
Mhm.
Oh, yeah.
Mm-hmm.
Took 10 hours, I think, to get through Florida.
And it's just as wide as
Yeah.
it is. Because the first time Bob and I went through the Panhandle, I said, my God, it's just like going to Key West.
I know.
But I like it up around the Panhandle.
I like Key West. We enjoyed it down there.
I do too. It just takes so long to get there.
Yeah, it does. The best thing to do would be flying, but I don't want to fly. I'm like you now. I don't.
Yeah, I don't want to be going through any airport.
Now, Stephen and them went to Seattle for a wedding, and he said it was nice because there was hardly anybody in the airport.
Mm-hmm.
And they flew on the airline that left the center seat open.
Yeah.
I forget.
Well, and
Alaska
you see where
Air.
Disney's laying off 28,000
Yeah.
people. Wow.
They flew on Alaska Air, I think.
Was that you?
Yeah.
Hey guys, it's Cheryl. Can you see me?
I cannot
Well, we
see
lost
you.
her. There
We
go.
can hear you.
Yeah, I know. I don't know what's wrong. Let me see
There's
if I
Ted.
have
Yeah,
the wrong, because I can see you guys, but let me see what's wrong here.
good news now.
It's a fascinating reversal from a week or so ago. Biden's campaign has been virtual for months. With 29 days to go, though, it's Biden who's out. He's on the campaign trail. It's being done in a dramatically different way than Trump has put on the campaign trail.
How about now? Can you guys see me now?
No,
Nope.
man.
What
Can
the
still hear
heck?
you.
I wonder what's wrong with my phone. I just did an update on my phone, and I can tell you that. Oh, hold on.
There you
There you
are.
There we go.
Hey,
I just did a new update to my phone, and there's a lot of things that have changed. Now I got it. Okay.
Yep.
Are you feeling well now, Cheryl?
Yeah, I'm feeling good. Yep.
All over that surgery.
Gallbladder's gone. Yes, I feel so much better. Thank you.
got rid of that unnecessary piece of a body, huh?
Of equipment, yes. Yes. Yeah. It was, yeah, I feel great. Actually, I feel so much better.
Oh, great. There's Dr. Cowan. Thank you.
Hello.
Hey, Paul.
How are you?
Yeah.
Hey, Bo.
Hi.
You going to join us by camera as well, video?
I hope so.
Okay.
Any idea how to do that?
Sounds like you.
Cheryl
You have
just learned how to do it again.
There it is.
You have
Yep.
to go to the bottom of the screen and click start video.
Yep, just found it. I hope. Can you see me okay?
There
Yep,
you go.
great.
You're there.
Yeah.
Terrific. Okay. Well, it is noon. So I think we can go ahead and call this meeting to order. I think we're all here. Dr. Tam's on too. Hello, Dr. Tam.
Good afternoon.
Great.
Good
Thank you
afternoon.
all.
Hi, David.
Thank you for joining us. So we're here for our regular meeting of the Board of Health, which we changed from last week to this week. And Dr. Marvel's on with Susan, I see, as well. And I want to thank Dr. Marvel for his serving as the chair of this committee for many years. And as you know, we identified that we needed a licensed or practicing physician to chair this committee. And Dr. Cowan has been willing to step up and do that. So Paul, we welcome you to this committee and look forward to your being part of it. As many, many years passed without us having to really convene the Board of Health, but the pandemic has changed every bit of that. And now we've been meeting very regularly. And Dr. Tam has joined us several times since he joined the staff over at BB back in March. And we thank you for all you've been doing as well, Dr. Tam, and thank you for your participation. The committee has, we've basically been talking about what the status is of the pandemic and how it's impacting the state and how it's impacting BB and what BB's response has been and how we as a community can, what we as a community can do to continue to respond in the best possible way to what this pandemic has done to our community. So with that, I would, first item on the agenda is the approval of the minutes. And Paul, since you weren't part of that meeting, maybe I'll just deal with that and then we'll turn the meeting over to you. Did everybody get the meeting minutes in advance? And were there any additions or deletions or corrections?
No,
No, I
I
didn't
have-
have any.
Okay.
I've never gotten the minutes.
I didn't
You
get
didn't
them.
get them?
I didn't get them either.
They were attached to the invite. Okay, well, we won't approve them then. We'll get them out to you, okay? So Paul, can I turn the meeting over to you at this point? And you have a copy of the agenda?
I don't have a copy of the agenda, and I'm not necessarily prepared to chair the meeting, I think.
Okay, well, we can go on. So the first item then on the agenda was an update on the coronavirus in Delaware. Now Anne Marie has put up the agenda.
I tried. Hold on.
Okay, wouldn't stay up. Anyway, and I think what we know is that the governor has signed the 7th extension of his emergency order at this point. That happened over the weekend. And Paul, is there anything you can offer in reference to the status of statewide, or Dr. Tan?
David, I think you're probably better versed than I am on that.
I know Dr. Tan's been participating in the statewide re-entry or reopening program, and that report just came out. So Dr. Tan, perhaps you would be able to give us some more information.
Sure. Thank you very much, Mr. Mayor. I think that the Pandemic Resilience Advisory Committee, the PRAC, has put together its proposed recommendations. None of it really is of a complete surprise, and I think one of the big things to just stay up front is that it does, the report and the members of the committee do believe that there will be a resurgence. The question really boils down to what we need to do to make the resurgence of the infection, as we always talk about. You can be infected with the coronavirus, and that's separate than the impact of people being infected and getting sick and causing significant morbidity and mortality. Hospitals being inundated with very ill patients. So the goal of the PRAC was to try and continue to reduce or flatten the infection rate so that we can all continue to minimize the impact of that on the community and the health system. So I don't think that there's anything specifically unexpected in the report. It does talk about business development as well as trying to keep the economy open. From the healthcare perspective, the focus really is continuing to reach out to populations of disparity, to educate as many people as possible about, at the end of the day, the 3 things that we all need to do, which is the 3 W's: wash your hands, wear a mask, and watch your physical distance. And then, of course, it does talk about the flu vaccination process, and I can speak to that as well, and making sure that as many people are as vaccinated. And of course, once again, vaccination does not prevent you from getting the coronavirus infection, but can potentially mitigate the impact of getting the flu, getting sick, and then getting the coronavirus infection, which then could cause significant problems, especially if you're in one of the risk populations. So I think I can talk more about that, but right now, here's where we are in Delaware as well as across the country. Delaware is seeing an uptick in our percentages of people who are testing positive. Thank you for putting that up. But as you know, over the last 14 days, we've had, if you just go down a little bit more, this is this for Sussex County or is this for the entire state, Henry?
It's a state, I think.
Yeah, but actually the state does follow, Sussex County is also following the state. We've had a number of positive, increase in the positive testing percentage, as well as an increase in the number of positive cases. That's of concern. It is not necessarily unexpected following, of course, now several weeks following Labor Day. I think we're seeing people with pandemic fatigue. I think we're seeing people who are now going out and doing things. And I don't think that it's necessarily abnormal or unexpected, but even here in Sussex County, we've had a spike in the number of positive cases, as well as the number of people who are, the number of percent of tests that are positive. That's a little bit of concern. We actually had at the hospital about 2 weeks of no COVID patients, which was a really good thing, but we are still seeing patients coming in and now being admitted with positive COVID tests. And so we are clearly not out of the woods. And what we are doing at the hospital is just making sure that we're putting out as many messages as possible, both to our staff as well as to the community, that this is not over and that we need to continue basically doing the 3 things that help keep things quiet, which is to wear a mask, watch your distance, and wash your hands. I'll stop there for a minute and see if there are any questions, Ted.
Thank you. Anyone have any questions?
Yeah, it's Cheryl. So I don't have a question. I just wanted to tag on what Dr. Tam said, that we went for that period of time without anybody admitted to the hospital with COVID. But we did still see those patients in the emergency room that didn't necessarily have to be admitted or had COVID symptoms and then, were pending testing. So it was great for those 2 weeks not to have, some folks in the hospital with it, but we did still see some in the ER only because I do those numbers for the state, then the federal reporting. So it still had people in the ER that were still coming in with symptoms, just not as severe enough, which was thankful, like Dr. Tam said, not to have them have to be admitted.
I know in the past, Nancy has had several questions about tracing, and certainly in the last couple of days, we've been talking a lot, the national media has been talking about tracing, and we now have this app that's available statewide for tracing. Dr. Tam, do you want to speak about that a little bit and how that is going? Or do you have any information?
Yeah, I don't have a lot of information on that. DPH is still, of course, the tracking agency. Other than, of course, at BB, we do contact tracing on our own employees who are positive, and then make sure that we are ahead in terms of identifying who else that staff member may have been exposed to, so that we can do everything possible to keep people out of the hospital, especially employees, in an isolation situation, to mitigate the impact of the infection in the hospital. I mean, our goal is to keep the hospital open. Our goal at this point is to even keep the hospital open if there is a resurgence of the pandemic over the next couple weeks, next months, because we recognize that the first time around we did what we did, and I think it was still the right thing to do. But certainly, it did create challenges for many people who then had their care delayed or did not want to come into the hospital, and as a result had significant complications from something that they should have been seen. So now that we have our hospitals and clinics, fully set up in a different way with physical barriers and a whole different approach to physical distancing, we feel that our clinics and our health system is safe. So we're not necessarily going to keep the patients out. I think the only challenge is to make sure that the hospital and the health system staff are healthy and are able to take care of patients as we enter the flu season.
I think we've heard a lot about Western Sussex having an uptick, and also up around Dover and in Newark. Are those the real hot spots in the state? Is that still the way it is?
I think it is, and I think that there's a lot of stuff circulating about things like long-term care facilities and skilled nursing facilities once again being a focus. But I think for us, I've been able to work really closely with the poultry industry. I just met with Mr. Perdue last week, and of course I'm in contact with Mr. Plylar at Mount Air, and they're doing a pretty good job with their surveillance testing. So I think those are really important things that the public needs to know, that they're just really working hard on making sure that their staff, their employees are being monitored in terms of infection rates.
I have a couple questions.
Go ahead.
Is there any study to look at what the effect of having the bars open has been? And then I've seen one report of a student at Cape Henlopen. Is that the only one you're aware of?
That is the only one that I am aware of, Nancy, at Cape. I have not heard of any others, but once again, that contact tracing goes through through the state and then to the school district. But I have not heard of anything. It wasn't clear to me
whether the Cape Gazette picked it up from a letter to the parents from the school or whether the school announced that. It didn't say, but I didn't have the sense that the school had been very proactive about it, except with parents and students.
I think the school is being very proactive about this. We are working together with them on, developing a surveillance strategy that's appropriate and, that is consistent with what parents are okay with. My understanding is that on this case, I think it was in actually the letter that it wasn't necessarily an infection as a result of contact at the school.
They were pretty categorical in saying it was not. I was a little concerned that how they could be that categorical, but it may have been a family event or something. They didn't provide details and that wasn't absolutely necessary, but I would just underscore again that it's more than the parents and students, it's the community. That those people go to the grocery store, they go to places, doctor's offices, and that the rest of us need to know what's going on at the school as well.
Well, I think you're absolutely right about the fact that it is the community. And, for us in the health system, many times it is not about getting an infection or getting exposure in the hospital, but the fact that people have lives and they're out doing other things. And, we work hard to make sure that our staff, at least, are continuously encouraged that they should continue to protect themselves and their families when they're doing things out in the community.
Thank you. And the bars? Any evidence about what's happening as a result of the bars?
I do not have any data about the bars and whether or not the contact tracing shows that the bars are a hotspot or if they're a source of infection or not. I think that that's a contact tracing issue. I can reach out to see if Division of Public Health puts that out. As you know, some states do. In California, they actually have a pie chart that shows where this where the infection source seems most likely to be in terms of gyms or bars, theaters or schools or colleges or things like that. But I don't think we have it here in Delaware, or at least certainly not in a published format.
Yeah, if it was accurate, it would be very helpful.
I think you mentioned the idea of people being fatigued with the social distancing, and that's certainly an issue. One of the things I've heard from several people in the medical community is people have deferred routine medical things or elective surgery and things like that. Have you seen a pickup on that kind of thing happening, or those kinds of surgeries and things happening at the hospital?
So the answer is yes, and this might be one where if I could defer that question to Dr. Cowan, our new chair, simply because as an emergency room physician, he sees that. So I don't know, Paul, if you want to speak to that.
Sure. So we had a backlog of elective cases in the organization as we suspended our elective cases during COVID. I think we're pretty much caught up with that now. When I talk to the people our anesthesiologists and our surgeons, I think we've kind of covered that. Interestingly enough, so we saw a significant decrease in the total number of people that presented to the emergency department for care during COVID. When I say significant number, our volumes were down by maybe upwards of 30 or 40%. Those volumes are starting to come back now. We have people, quite frankly, that were just afraid that the hospital represented a significant risk factor for COVID exposure for them. But I think that our volumes are sort of getting back to normal. Our September volumes are similar to our past September volumes, at least in the emergency department. Our summer volumes definitely were off by 10 or 15%. So, but I think we're getting back to normal from a total volume standpoint. If I understand the question correctly.
One of the things,
and if I could just
go ahead.
If I could just follow up with that, Dr. Cowan, you're right. Our volumes had come down. It is a national trend, actually, Mr. Chairman. Across the country, all health systems are showing a reduction in ER and even primary care visits in urgent care or walk-in. And it has to do with simply the fact, I think, that for many people, it's a combination of the fact that there is still an uncertainty factor. People are trying to not get infected, trying to not be exposed. And then, of course, the other thing is that in many cases, people are concerned about, healthcare and the expense of healthcare. And I think that's another factor as well with the economy where it is. As a result, we've done everything compared to the first surge, right, of making sure that we ensure that our clinics, our emergency rooms are safe, and that we communicate that information to our community. And this is a great opportunity here for me to just speak to the fact that we have instituted many features for safety to prevent people getting infected or people getting exposed to coronavirus in our clinics, in our facilities, in our walk-in clinics. And then the last thing I'll say is that the other part we've seen is that we are concerned about people not getting their health care. The longer you wait, if you have a symptom, if you have pain, that if you wait, think they might get better. There's a possibility that it'll get worse. And I think that that's a concern for us as well. So we also are putting out the message that we really encourage people to access their healthcare system as needed.
That fits right in with what I've been hearing from some of the cardiologists and others who have been saying that people who are scheduled for routine care have been avoiding it. And in some cases, they're ending up in the ER because they haven't been getting their routine care that they would normally follow up with their physician's office. So getting that message out of all you've done at BB and in the associated practices that to make things safe is really important. And we'll certainly do everything we can to make that known through the city. Thank you very much for taking time to address that. We've also, been talking about what can we do safely in the community. And actually at our city council meeting last month, we did officially cancel trick or treat. I noticed that the governor has now come out with some guidance that saying trick or treat might be possible, but of doing it from a very, very distant way. And I don't anticipate that we'll go back on the idea of canceling trick or treat. I know the Episcopal Church has always had a big trunk or treat activity, and they actually canceled that in advance of our situation. And so in terms of other social events, the guidance is still 250. I know the Historic Society had their craft show this weekend. They limited their admissions. I'm not aware of any problems that they had. I think people were being pretty respectful. And as Nancy asked about our reopening of the bars reopening and seating and restaurants serving, for the most part, I think they're being pretty careful. But does anybody in this group have comments or observations they would like to share? I know our police department have been monitoring that from time to time, but if anybody has any observations, be happy to. Nancy, have you heard anything that brings you more concern?
I have not, and frankly, I'm not going out, so I don't have any personal experience.
Okay.
I just don't have any confidence in it, frankly.
Okay. Got it.
I think that people are very lax in wearing their masks. I know they're supposed to be, but I've watched it uptown and it's just not happening.
Really? Okay. I'm not.
There is a degree of complacency that's apparent around town. Now, some of the restaurants I know are doing a very good job of cleaning their things, putting barriers between the booths and so forth. And I think that they should be commended on doing that. But I think overall there's a sense of complacency. And I think we have to be careful because a lot of these new cases are in younger people who won't require hospitalization as much as the older folks, as us older folks.
I did notice I had to pick my grandchildren up from the high school the other day. And when I was sitting there, they have a monitor watching the students come out and to make sure they had their masks on. And there was one young lady who did not have hers on, and the woman told her to put it on. She did reluctantly, and 2 feet away, she yanked it off, you know. So, I mean, it's hard to make young people realize just how important this is.
Right.
And it's so simple.
It is very simple. Well, we were the beneficiaries of the American Legion Auxiliary, the hospitality ambassadors, for most of the summer, and they did a really good job. And they have now stopped their effort as we're over the peak period, the peak tourist season. But I think we all need to be mindful of what the importance of wearing a mask, just what you can do to prevent it.
I was out at Cape Henlopen on the trails last week with very few people with a mask on, or even one around their ears. The trail that goes to Georgetown, that's near my new house, people are more compliant on that one, particularly the bikers. They've actually had their masks on.
So I don't think that there's a requirement to wear a mask on the trail. So I think that part of the
But they don't even have them. There is one at Cape Henlopen. The sign says must have.
Right, you have to have it with you. Exactly.
Right.
There's no enforcement of it and people are not complying.
Right. Okay. All right. In terms of reopening, one of the things that we've been discussing is the idea of the Christmas parade and what we're going to do with that. And I don't think we've come to an official decision yet on that. It looks as though nationally, many Christmas holiday events are being canceled. I expect that since that is a joint function between the city and the chamber, that there'll be a decision forthcoming very soon on that. But we're very concerned not only about the participants, but also the crowds that gather to watch the parade, and how could that be done safely? And obviously, we know the Rose Bowl parade's been canceled. Dr. Cowan, you're Dr. Tam, you probably know that very well from coming from California. And I think we have pretty strong concerns about the safety of that. I think a couple of other communities have already canceled their holiday parades. So that's just one of the many topics that we're looking at.
If I could, Mr. Mayor, I think the challenge here is that it is such a dynamic process. I will be the first to admit that it is a hard thing when you have a flattening of the curve, or you actually have a reduction. Your positivity test rate is going down 14 days, and then all it takes is 2 or 3 days for it to go back up, and then suddenly your rate is increasing rather than decreasing. And so the challenge is all these decisions that are 2 months away, depend upon what is happening right now within a 10, 14-day period. So I understand the challenges that you have. In fact, I think one of the webinar questions that were asked is Are patients allowed visitors now, and at what level? So, I think that's one of the things where, especially as a result of what Cheryl was saying over the last 2 or 3 weeks, and the negativity rate, the positivity rate going down, we had decided that at the hospital, balancing out both the safety of infection with the fact that we still, to be perfectly frank, having family members visit patients in the hospital is not just it's just a convenience issue, but actually a quality of care issue in many respects. That we had now revamped or accelerated or increased our visitation rate, so that we are now allowing 1 visitor per patient to come to the hospital between 2 p.m. to 7 p.m. As you know, that is a combination of both making sure that we still reduce the number of people who come into the hospital, but also protecting, because when you come in, you're wearing, masks and everything else, and we're just making sure that we are protecting people, especially on the floors, with wearing PPE. And that's a challenge when PPE is still a shortage, as Cheryl will tell you, across the country. But we are doing that, and I think this is a similar situation to where you're at, where that visitor policy could change if all of a sudden we have an uptick in both hospitalizations as well as the positivity rate of testing in the county. And I think that's an important thing in a public hearing like this, that people know that this is not something that it's because we're not doing it right, or we're making poor decisions, but we're balancing out all these factors with just the available information that we have.
Right. Very
Right.
true. Yeah. Other questions or comments?
Dr. Tam, I do have a question. As you had mentioned, the percent positive has gone up, hospitalizations are up. I had heard that, and I think it's been said even in this meeting, that a lot of the newer cases are young people, but with hospitalizations going up, it strikes me that there's more to the picture than young people doing what young people do at this point. With hospitalizations up, that leads me to believe that the demographics are more widespread. Is that what you're seeing?
Well, first, without violating any privacy rules, but in a general trend, the type of patients who are coming in and being admitted to the hospital actually are trending younger than they were before. And I think that's an important consideration. And that's national, by the way, rather than simply here in Sussex County or even Delaware. I think it has to do with the fact that there is greater exposure out there amongst younger people. I'm afraid that I don't even count myself as one of the younger people anymore, but after this last 7 months, I'm definitely not younger. But I think that's one of the challenges here, is that more exposure is going on amongst younger people for a variety of reasons. It's not just because they're being irresponsible, but as a percentage, I think the older population have gotten the word. They're staying home like Nancy. They're doing everything they can to minimize their risk of exposure. And I think that this is one where the younger population will slowly start to get that as they hear more in the local news as well as in the national news about the fact that, there are truly clinical implications for being COVID-19 positive if you're in your 30s or 40s or even your 20s. Dr. Cowan, I don't know if you have any thoughts on that.
No, I mean, I agree with your comments with that.
I'd just like to continue to encourage you to reach out, get the governor involved to keep putting the message out. I'm very concerned about the fallout from Bethesda this week, of just the poor example. And I think we've got to reinforce the message of what can be done. Your 3 W's is a good summary of it, but really not get fatigued about the messaging.
Yeah.
Well, Nancy, as you know, we at BB are doing all we can to get the message out, to communicate with people. That we want to make sure that patients, come to the hospital if suddenly they're feeling weak on one side or they're having some chest pain or something like that. We don't want them to be struggling with healthcare problems. So it is a balancing act, but Nancy, that if there's a medium out there, that BB Healthcare will be on it talking about those 3 W's.
You've done a great job of doing that. You're on every media that I see. You're somebody, you especially, Dr. Tam, are out there, but the hospital's really done a great job of being out there, making sure that people are informed. And because of the way the media is distributed here, you're not only reaching the Lewis community, but you're reaching all of Sussex County, and that's very, very important. And we thank you for that.
Well, it's a team effort, certainly, and I know that I've asked every one of my staff to go out there and, as Nancy said, if they see younger people, because some of our staff are younger, that they need to continue to be examples and remind people and share with them the need to do this. So it is across all levels that we are trying to ensure that we communicate as effectively as possible. And Nancy, I hear what you're saying, and continue to talk with all levels of government about what we can do to communicate with the.
Thanks. And it wasn't meant as a criticism. It was a push to do more. Thanks.
Yeah. Well, it's okay. I was rounding in the hospital yesterday, and one of the nurses said that her mother had come up with a perfect Halloween costume for me, trick-or-treating notwithstanding, Ted. And they suggested that I wear a costume. I play the role of Waldo on Where's Waldo. So, that's coming from a nurse's mom, which is kind of scary, but we want to be everywhere because we are the community's, local health system.
Yeah, I noticed the guidance today put out by the governor's office talked about Halloween masks are not an effective mask, that there's just too much leakage, etc. So they were very cautious in what guidance they did put out. So and I do think that the psychosocial impact of all of this is really beginning to wear on people. Have you seen an uptake in number of calls for emotional issues or behavioral health issues at the hospital, Paul?
That's going to be really hard to quantify. Certainly,
Yeah.
No one's going to say, I'm here tonight because of COVID. Certainly, mental health calls for mental health in the emergency departments across the country seem to have increased through the pandemic. So I think that's true for whatever reason, and it's what you would expect over time. So there's a psychosocial component to this that's very real.
Yeah, I think there'll be long-term impacts on that. The other issue is, I think telehealth has been the big success of this program. It seems like everybody's gone to virtual appointments with doctors. I know I had one the other day. And I guess, Dr. Tam, you must be hearing a lot about virtual health appointments or medical appointments that people are keeping. A lot of medical officers are doing that now.
Yes, this is one of those areas where actually telehealth has continued to be a significant portion of our clinical work, even as we bring on more providers. BB Healthcare has continued to bring on more family practice and internal medicine doctors over the last several months, and we continue to recruit more physicians. As you know, we have a shortage of physicians here in Sussex County, not just here at BB. But the other thing we're doing is we should be pretty close, if not already here, with starting our telepsychiatry program, where as part of our telehealth initiatives, we're offering psychiatric therapy appointments using online or a telephone, telehealth, video type mediums. I'll be putting out more of that on social media as we get to a point where we, have things like phone numbers and how you should get that referral and so on and so forth. It'll be, it won't be covering all the services that we need, but it certainly, I think, is a first step. This is one of those areas where it's critical that we work with as Nancy said, with the governor and the state about how, what kind of providers we can get into the state to do this kind of work.
Right. Great. Okay. All right. Dr. Marvel, do you have any comments or questions as a?
No, just my impression has been that a lot of these positive cases are in the younger age group, and a lot of them don't need hospitalization, so that we can't use the number of hospitalized patients as we used to determine the trends as well. And I think that we have to be careful that we don't let this get out of hand, because I think the surge is still to come, and we'll have to deal with it when it comes.
Yeah, and this is a good time to remind everybody that BB's done a great job of offering of flu shots available, and I want to thank you all. I know people, we're doing it at City Hall, and I know that you have your 48 clinics around that are going to happen over this month, and they've already started. So good reminder for everybody to get out and get their flu shot.
I plan to go.
Good.
That's good, Dr. Marvel. We need you healthy.
Thank you. I appreciate that.
In the early flu shot clinics that you've been holding, have you noticed an increased number of people coming out?
Yeah, absolutely. We've noticed that, and I will apologize to the public that sometimes there's been a little bit longer wait than we wanted to do. It's a combination of both trying to make sure that people are physically distancing and that we're doing things in a safe manner, which slows things down just a little bit, and B, especially in the high dose flu vaccinations, like what probably Dr. Marvel is going to need to take because he has a lot more years of experience than I do. I think there's been a shortage. I think people around the world are recognizing that they need their flu shots, and so we've had a couple times when there's been a shortage of the vaccinations. So since this is a public hearing, we'll put it out on social media as well. But if you are going to one of those locations that we've published, please make sure to go to bbhealthcare.org and just check to make sure that there hasn't been a change, because we don't want you to come and find out that there is no high dose vaccination available because of a shortage, because of a delivery that did not come. And of course, we put that out as much as possible so that people aren't inconvenienced.
That's very helpful information. Thanks.
And you know what, Ted, if it's all right with you and Anne Marie, I might actually ask our communications team to hook up with the Lewis City website,
Sure.
like a little notice, if you want. Maybe I can ask our Christina Deidesheimer, our VP of Communications, to figure that out so that people can also look at your site of upcoming information or contemporary information if there is one of our clinic sites that is not able to provide a high dose vaccination.
That's terrific. We'd be happy to work with you on
Thank
that. Yeah, that's great. Especially given the demographics of our age population. It's very important that people have access to the high dose. So, okay. Anything else anybody has to bring forward? Okay. If not, I think we probably should look to scheduling another meeting. We've been working on kind of a 3-week schedule. Paul, does noon work best for you?
Actually, earlier in the day is better, but I can make noon work if that's what you typically have had.
Okay, what time is best for you? Looking 3 weeks out, that puts us into
The week of the 26th.
the week of the 26th, exactly. Thanks, Anne Marie.
And what day of the week do you typically have these?
We've been doing them on Monday, but we can do them on another day.
Well, yeah, let's do it on the, can we do it at the 26th at 9 o'clock?
I think that could work. Anne Marie, do you have anything on the agenda that day at 9 o'clock?
No, that looks like it would work.
Okay.
Good.
All right. So then we'll plan to get together again on the 26th at 9 a.m.
Good.
Okay.
Okay, that sounds good.
Thanks, Cheryl.
Good for me.
Yep, that's good.
Great. Dr. Tam, hope you can join us then as well.
I serve at your pleasure.
We're very happy you're here. Thank you very much.
Thank you.
Thank you.
Great.
So if there's nothing else, if there's nothing further to bring forward, we'll carry some of this information. We have our city council meeting next Monday. We'll make sure that this information is shared during the remarks section of the council meeting. And we'll provide that link as soon as we are able to get it to us on our website. So, thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Have a good
Thank
afternoon.
you.
Meeting adjourned. Thanks.